Hi, I'm Lauren Masi, Doctor of Physical Therapy and Board Certified Orthopedic Clinical Specialist. I'm also the owner and Clinical Services Director of Bay Area Physical Therapy and Lafayette Physical Therapy. Today we're going to talk about how physical therapy can relieve chronic pain and improve your well-being. First of all, I want to lead with what is pain, and to realize that pain is just a signal to your brain telling you that something's happening, and then your brain has to actually take that in and make a decision on what to do about it. The perception of pain is very person specific, but your brain has to figure out what is safe or what is unsafe. And a lot of times people might be afraid of what that information means. They don't know if what they're doing or what they're feeling is detrimental to their healing, or if it could be helpful, right? That whole no pain, no gain slogan can depend, and it depends on the type of pain and where you're feeling it and what's causing it. A lot of times people also might be afraid to seek help for pain because they don't know if it's a poor reflection on them for something that they might have done wrong, or they're going to be told that they have poor posture or that their strength training program isn't appropriate, or they might be afraid of finding out that something is really wrong. But more often than not, it's not a huge, terrible medical issue, and physical therapists are here to help. A lot of times too, if you've had an injury or you've been feeling pain for a long time, you might be fearful because you want to avoid that injury from recurring, or you're just scared of that feeling and you start changing the way that you move. These are total normal reactions, but they can lead to muscle imbalances, weaknesses, tightnesses, and bad habits that can have a negative impact on your future and your ability to return to your prior level of function and potentially the athletic endeavors that you seek to return to. We of course want to get you back on the right track as soon as possible, but that will include doing a full assessment of the root cause of your pain. Let your physical therapist be your partner in recovery, and we can help you, give you that peace of mind that what you're doing isn't wrong and that everything is possible. Physical therapists can and will help you address these chronic pains in your body with a variety of treatments. We can help set you up with stretches and exercises to strengthen, massages as needed or soft tissue manipulation, joint mobilizations, and modalities, which are machines that can help control your pain as we are accomplishing these other things. For example, I have patients all the time who tell me that they'd love to stretch or they'd love to do strengthening exercises, but it just hurts too much and the pain stops them from even trying. So sometimes there is a place for some of those modalities to help control your pain to then allow you to try to do these other things that are going to actually make you better. One of the treatments that we are lucky enough to have here at Lafayette Physical Therapy and Bay Area Physical Therapy is the Class 4 laser. It helps control pain, and oftentimes we use that as an adjunct to physical therapy so that we can get you doing those other activities to make the lasting changes we need. If you start to notice a change in your body, whether that's decreased mobility or your activity level is starting to decrease, or a nagging pain that isn't going away or is worsening, stop and ask yourself why this might be happening and challenge yourself to get back on track as quickly as possible. Are you just choosing to be more sedentary? Is your posture just kind of being lazy, or have you dropped out of the gym and you just need to get going again? If you can address the root cause, that is your first step towards recovery. And if you need help to do so, please reach out to our front desk to set up a complimentary consultation or an evaluation as soon as possible. Thanks so much.